Hello, my name is Dr. James Akwa. Welcome to another edition of Kowa Health Hour. Today, I'm bringing you hepatitis B. Hepatitis B is a viral infection that affects our liver. So usually the virus is called hepatitis B virus, HBV, hepatitis B virus. It's a virus that when it gets to your blood, they affect your liver. That's why we call it hepatitis B infection. And the name of the virus is called hepatitis B virus. Hepatitis B affects almost about 30% of people. So for example, people living in low-income countries, 3 out of 10 might have been exposed to hepatitis B virus in their lifetime. So it's one of the global conditions that we need to really look at. Hepatitis B is spread through, one, from mother to child. So from mother to child, for example, if your mom has it and is not controlled at birth or prevented at birth, your mom can give it to the new baby. Also, sharing of infected needles, blades, even toothbrush, you can get hepatitis B through it. And most importantly, through unprotected sexual intercourse, because the virus can be found in body fluids such as semen, vaginal fluids, and blood. So anything that gets to do with sharing of body fluids, you can get hepatitis B through those means. Everyone is at risk. Most importantly, those from low-income countries who do not observe this protective measure, for example, safe sex or sharing of needles. You know, some of these developing countries, even syringes that are used at the hospitals are used by multiple patients. So needles that has been used should be disposable, or sometimes even going for tattoo when they use these devices that they do not sterilize it, or even at the barbering salons or even at the female salons when they use these sharp objects that did not sterilize it. So these low-income countries are at risk of getting it. Also, for people that have multiple partners. So for example, if you have multiple partners and you have unprotected sexual intercourse, there's a more chance of you having it. It's also common among the youth. That's because they are mostly sexually active and those with weakened immune system. So because, for example, if the virus gets into you and you have a stronger immune system, you are capable of preventing it. But if your immune system is weak, then there's a high chance of you contracting the virus. Those who are at risk are those from lower income countries like Africa, those who are involved in multiple sex partners among the youth, and those who visit salons whose equipment are not sterilized. So most of the time you experience lower abdominal pain. You know, I told that hepatitis B affects the liver. And if you look at the location where the location of the liver is, it's on the right side of the abdomen. So you start feeling the pain, sometimes fever, nausea, you wake up with general body pain. And one of the most prominent things that you see when you are having hepatitis B is the yellowing, that's the jaundice, yellowing of the eyes. So you see your eyes getting more yellow to greenish, and you should know that your liver is affected. But most importantly, you start feeling general body pains, you feel like vomiting, sometimes you vomit, or your skin, sometimes the skin coloration becomes something like yellowish. And then your urine, you see that you started having the more dark yellowish to a dark urine, and then you start having pains at where the liver is located on the right side of your abdomen. So these are some of the things that when you start having them, you should know that it's possibly a hepatitis B infection. Hepatitis B, if not treated or not controlled, can lead to what you call liver cirrhosis. Liver cirrhosis is a condition where there is scarring. So it's like you're having a cut on your skin and then that leaves a scar. So when your liver is affected by this virus, over time you will see that this virus leaves scars on your liver, and also it can lead to a liver cancer, what you call the liver carcinoma. It's through a blood test. So usually your doctor will take a blood sample and take it to the lab and then test whether you have the hepatitis B virus. Yes, it can be treated. So this is where the main argument comes from. People are asking, can hepatitis B be cured? Can it be treated, or it can be managed? 90% of people that are exposed to hepatitis B, your immune system itself can take away the virus without maybe even you knowing. So a lot of us have been exposed to the virus, even we never got tested, but your body's immune system have gotten rid of it. And then there is 10% of people that when they get exposed to the virus, it leads to what we call the active chronic infection. So for these people, you need treatment before you get well. So the test that you do, we have two main types of tests. The antigen antibody test. So for that example, if you go to the lab, the first line of testing is they will take your blood sample and then check. Mostly those tests is called the antigen antibody test. It is really testing the virus against the soldiers that your body produce to be able to fight the virus. So for example, if you are tested positive, it doesn't end there. It means that you have been exposed to the virus. Then we have another test called the viral load. Viral load will test how many of the viruses, how often do they, because the virus, they also require replicate. So they also grow or multiply in numbers. So that viral load will actually tell you the number of virus in you at the moment. So with these two tests, now you go to the treatment option. You will be forever test positive for hepatitis B. It's only few instances where the body itself will take away the virus and then you go and test and it's negative. But in most cases, forever and ever, you'll be test positive for hepatitis B. But let me ask you, so when you are forever test hepatitis B, are you automatically going to get cancer, or you're going to get a liver cirrhosis or any of the complications? No. You might test positive always, but your immune system has been able to contain it and you might not even fall sick. But then sometimes when you test positive and your immune system is weakened or you don't get enough treatment, then it leads to all this cancer I'm talking about. So the treatment options: one, you are not treating either being it positive or negative. Most people confuse it like, oh, I'll give you a medicine that when you drink within 1 month, 3 months, you go and check and it's negative. And then the moment they take the medicine, they go and check and it's positive, and then they get disappointed. Normally what you do is that once you test, we move on to do what we call the viral load. Once we get your viral load, then you put you on treatment. Over time, we repeat the viral load. We repeat the viral load, and then you will be able to compare your first viral load test to the latest one. This is when we are able to tell whether you are getting well or not. So most people that say, oh, even there most times you don't require treatment. About 90% of cases of hepatitis B don't require treatment. But once you have hepatitis B, we test you have hepatitis B. The next stage we move on is to do the viral load. And then there's another test called the hepatitis B profile. So the profile can give us that, okay, you just got exposed to the virus, or your immune system has been able to contain the virus, or the virus is actively going on, and then we need to do something very urgent. So all those things will be done for us to even assess you whether you need treatment or not. So the treatment does not lie in you moving from positive to a negative. It might not happen at all, but we need to check whether your viral load, how many of the viruses are present, how well your body has been able to contain the virus, and that is the only marker to know whether you are really treating the virus or not. Like I said, in most cases, you don't even need to do any treatment. You only need to monitor to see if the viruses are still active or not. Yeah, so people have to, one, like I said, you have to do what you call the safe sex. Safe sex means that you are having sexual intercourse, that you are preventing your partner and yourself from getting any kind of infection. One of the most effective means is the use of condoms. And then also there are treatments or there are injections that are used to prevent what we call the mother-to-child transmission. So at birth, we give certain injections to the newborn baby so that they don't get, even if the mother is having, they don't get those kind of they don't transfer the infection to the child. And also always visit salons or barbering shops that have machines to sterilize the equipment after use, and never share blades, especially those that are in school. Never use a blade that has been used by another person, or sometimes you see a blade or any needle on the ground, you don't know who used it, and then you also use it. It might be contaminated with the virus. So never share blades, never share needles, and then also basic items like toothbrush or even hair combs should never be shared. Hepatitis B is preventable. Hepatitis B is manageable or treatable. So anytime you are tested for hepatitis B, seek for a professional advice from your doctor. Thank you again for today. We meet another time.